They say that having too much sex loosens the vagina. Is that true?
This is absolutely not true. Having too much sex does not cause permanent loosening of the vagina. This is because our vagina wall naturally relaxes during sexual arousal and tightens fully after that.
So will all women have this problem after giving birth?
For a young female in the early 20s or 30s, the vagina wall will actually return to its original state in about 6 months or so. So after that, in a typical young female, the vagina wall returns to their natural state even after given birth.
So does it mean that the more childbirths you have, the worse the problem will be?
Yes, after many childbirth, what happens is that the vagina wall will fatigue and no longer be able to relax to contract to the original state. What happens is that many women experience vaginal laxity even after delivering one child.
So does this mean that it tends to happen to older mothers?
Yes, as we grow older, our body naturally loses collagen from the body. Most women will experience some form of vaginal laxity as they grow older.
So does this mean that even when I am not a mom, this problem will happen to me when I grow older?
Yes, unfortunately, even for women with no kids, as they grow older, most women do experience some degree of vaginal laxity.
So even if I abstain from sex, the problem will still happen?
Yes.
There's another question from the reader, which is actually quite embarrassing actually. She says that she sometimes leak urine while having sex. Why does this happen?
Yes, stress incontinence is a very common issue faced by many women after childbirth. This is because that during childbirth, the pelvic floor muscles are weakened.
So is this a permanent situation or will the condition heal over time?
If you leave the condition alone, sometimes with an increased age, there may be even a worsening of the problem.
And does it mean that the more traumatic the childbirth, the more serious the problem will be?
This may or may not be so. Everybody has a different healing capacity. So some patients, they may heal better and some patients, they may not.
Now, I've heard of Kegel exercises, but I don't quite understand how that helps with toning the pelvic floor muscles.
It is recommended to perform Kegel exercise immediately after delivery. The recommendation is to do Kegel exercise 3 times a day for at least a duration of 3 months to see positive results.
In that case, is there any other ways that we can strengthen the pelvic floor muscles? Can we do it without any surgery involved?
Yes, the good news is that with the current medical technology, there are non-invasive and safe methods to help to strengthen the pelvic floor muscles as well as to address the problem of vaginal laxity. At Haley, we have the Exilis Ultra Femme 360, which uses radio frequency energy to gently heat up the tissues within the vaginal wall as well as the surrounding skin. This helps to stimulate collagen production and as a result will firm and tighten the area around it.
Is the treatment painful?
Both procedures are relatively comfortable and there is no need for numbing cream. Patients tolerate the procedures relatively well.
Is this the same radio frequency technology that people use to firm up their face?
The machine that's actually designed to treat intimate areas, so there is no issue with any side effects or causing any damage to the area.
So how long will this treatment last? For example, how many sessions do we need and the results, will it last for months or years?
For first-time patients who are trying Exilis Ultra Femme 360, we recommend 4 once-weekly sessions and subsequently they can return for maintenance treatment every 6 months. As for Tesla muscle former, we recommend the initial regime to be 1 session every week for a duration of 8 weeks. As for the effects, the effects from these treatments are generally long-lasting, but some patients may need repeated treatments if they have subsequent childbirth due to hormonal changes.
Why is it necessary to pair the 2 treatments together, pairing the Exilis Ultra and the Tesla muscle former?
When we treat vagina tightening, when we stimulate collagen within the vagina, we want to train the pelvic floor muscle so that these 2 areas work synergistically to achieve the better results.